Right.
All right, you're live.
You will call the meeting of the Delaware County Health Board to order. Is there any public comment on anything? I guess we will go to, let's approve the minutes for Monday, May 18th.
I'll move to approve the minutes for Monday, May 18th.
I don't even know if we can.
Well, I guess we probably can't.
We don't have a quorum.
Don't have a quorum.
So I guess we can have discussions, but we can't make any decisions.
That is correct. Sorry about that.
So I guess the first thing up will be the public health officer. He's not here. Public health nurse, Teresa, what do you got for us? There's Doc right there.
Oh, you just made it.
You can give us all your information, Doc. We can't make any decisions. We don't have a quorum.
Well, look, this is out of my purview, guys. It's something about a land thing. I'm not sure what this is.
Okay.
You know it, don't you?
Yeah, well,
Oh, the Kenton Lane Land Farm.
yeah,
Okay.
Oh, okay.
but, yeah.
Yeah.
That's-
Okay. We're on it.
So, okay, so I don't have to sign that.
I don't,
Well, it doesn't have a spot for the county health officer.
it says, what's it say? Oh, yeah, health officer. It's the same, I mean, that's what our food licenses say, and I signed for that, so.
Okay, you got in it then.
Yeah.
Oh, good.
Oh,
No, I. Thank you. Bye.
you got anything else for us, Doc?
I'll just come to see what y'all were doing.
We're all sitting here.
Oh, I did go, I think somebody went down to Three Forks Place, and I stuck my head in there too, and they were abiding by all the rules.
Oh, they were?
Yeah.
Okay.
Where did you say that was, excuse me?
That was yesterday at the truck stop on the other side of the highway.
Oh, okay.
We got another complaint.
Oh,
Well, Doc actually you got the complaint, right?
Well, I went down there,
Yeah.
and they had soap and they had gloves and all kinds of stuff.
Okay.
It looked like they were doing okay to me.
yeah.
So, but he had a complaint that there was no soap in the bathrooms and stuff like that, so,
I wonder if it's that same complaint. So I followed up on 2 complaints about no soap.
mm-hmm,
You know, I called and they said that they took care of it, that one of their employees didn't handle it properly, but that they got soap and dealt with that. Then I got another call from Gallatin County from their sanitarian. So then I happened to be going down there anyway. So I stopped in there and they had plenty of soap and they were doing everything else right. So I don't know if it's the same person cycling through
yeah.
with the complaint or what, but they had plenty of soap.
Hmm,
Yeah, they had soap when I was there too.
Thank you for doing that.
So,
okay. So it might just be somebody who's making waves then if we're getting that many calls. You know, the very first one actually was a food thing at Subway, so Sean did take care of that with the supervisor, so.
And that was a month ago or
Yeah,
6 weeks ago.
yeah, that was a while ago, so, but since then, we've had 3 other complaints, so I don't know what's going on over there. Mhm. But we're not the only one. I went to my brother's this weekend and stopped in at the town pump in Columbus, and they too didn't have any soap in their bathroom. I was like, really? But just after that, some lady brought in a bunch of hand soap from the shelf, so that was good.
Okay, so Sean, what do you got, anything?
Well, the only thing that I really have is that we're going to be moving to phase 2 starting next week. And phase 2 does allow for, the language in it indicates that we can go over the 50 people, or, it says we can now go to 50 people, but it also says that events can be held over that number of people if there's a plan in place with the local authorities. So that's going to put a lot of pressure on us to get those plans organized again and deal with that. So
Yeah, so that's one thing that I wanted to talk about because a lot of the calls that I'm getting for event planning are the ones that are expecting over 50. And so, I mean, I'm guessing as a board that we would make that decision that those plans have to have a plan and it has to be approved by Sean and I. And if the events are smaller, I guess what I was thinking was, I have some really good information that's kind of been passed from county to county. It started in Lewis and Clark, and they're just putting out things like, I actually have one for rummage sales, and I'm putting that out on the internet. And I apologize, I didn't get, I'll send them to you email, but putting it out on the internet, Facebook and that kind of thing, and I'm gonna put a little ditty in the newspaper on just, people have to be responsible for planning their own rummage sales. We cannot do that. There's just no way that we can do that. So just getting the information out there, the rules that they have to follow, and hopefully everybody's responsible enough to do that. There is a community-wide rummage sale. So I was actually planning on talking to the organizers of that, because it's, I guess, pretty big and a lot of people get into it. So as they're planning their event, I thought I could be a little bit involved in that so that everybody who signed up, because you sign up and then you get your name on the street where all these I've never been to it, but wherever all the rummage sales are, and just maybe being in on their planning event. And someone told me it was Vic and Pam Sample that do that organization or organize that whole thing. So I was going to get a hold of Vic and just see if I could be involved in that just a little bit. So, everybody kind of knows what to do.
So they're all in all separate locations, is that kind of the idea?
Yeah, everybody has it at their house, but then there's like a map that goes out that tells, where all the rummage sales are and what the street address is and all that stuff. It's been going on for a few years. I've never participated or even went to any of the sales, so I'm not too familiar with it. But so I'm kind of gathering information on that because I thought that would be a good thing for me to kind of be involved in the planning. just so that people are, you know, kind of expecting to follow the rules, you know. And so then we have the Rod and Gun Club one, which, have you heard any more about that, Sean?
Well, I think that was this weekend.
Mhm.
Pardon?
That was this weekend.
Oh, it was already done.
Yeah.
Okay. All right.
But they have another event coming up again, I mean, this summer.
Oh, okay. And so then there's a couple other things, that, one is just called, organizing your big event, keep COVID in mind. So I'm gonna do the same thing with that. You know, just get it out there and get it published. So, you know, people are reading about it and thinking about it. I think anything we can do proactively, you know, is gonna help in the long run. And then when it comes to the bigger events, then, I mean, don't you agree that we should have a plan like we did with the other ones? And
Yeah,
then,
anything over 50, it has to.
yeah.
So,
So that was for that, and I apologize, I should have got those things out to you by email, but I just didn't have time. So, and then, I kind of went through the other, plan and just kind of tweaked it, you know, this one that you did.
mhm.
I just kind of tweaked that so it would be applicable to all big events.
Right.
And then we could just kind of go from there, you know, and, just add whatever specific to that event. But, what I left in there was just all the general rules from, the Thompson event, so.
Yeah, I had Adam Six contacted me regarding the driving, I guess they're gonna do a driving movie at the fairgrounds,
So they're gonna do it?
or they're trying to, so I sent him those plans and said.
Who was that again?
Adam
Oh.
Six, you know his name?
Yeah.
Yeah.
Okay.
I don't know, he's with so many different organizations, I don't know who he was
Yeah.
calling with, but,
I know they're becoming more popular around,
yeah, we went to one in Helena on Wednesday. Such a fun.
now it's fairgrounds.
Yeah.
Yeah, that was it. Was
It
it
was
successful?
Yeah.
Okay.
Yeah. Very good. So, you know, each event will have to have, kind of like when we were talking for the wedding venue people, you know, you have to just kind of think of where their specific contact times or issues that could come up that are specific to their events, but for the most part, it's all the same, just like Teresa was saying. We can give them a pretty generic plan, and then we may just have to add a couple items.
And it'd be much easier just to have a template and then just kind of tweak it to their event, you know, because the rules are the rules, so, you know, it'd probably be easier to do it that way. Because I probably, well, without the gun club one, I probably still have 6 of them that are coming up, so,
So what's the approach for the walleye festival?
haven't even got to that one yet.
Are they still having it, or?
Well, I think they're looking for some guidance from us, and I need to sit down and talk with them a little. When I talked to Sean about it, he felt like if they have to social distance themselves, to a certain, 350 people trying to social distance, he didn't think that they had the capacity or the capability of doing that at the silos or, or at the restaurant to be able to do that. So they would maybe have to come up with a different, just do things differently, period. Maybe not have the big barbecue that they normally have. So.
I've never been to that either. Have you been to that?
I haven't gone since they moved it up to the bar. I used to go out at the lake, and I know at the end of the day, when they're giving out all the awards, you got 150 fishing. They still have 150 teams, or how many teams they have, and so you got 300-400 people that are all gathered in a small area.
Mhm.
And yeah, I don't know what are they, so with the new restrictions, with phase 2 of the restrictions, there's no longer the 14-day quarantine, right?
Right.
So that'd take care of all your out-of-state fishermen coming in, but then that exposes us to a problem.
Mhm. Yeah, so we still have to be pretty harsh on the, social distancing, because there are a lot of them from out of state or out of our country, or county, I mean. But it depends where they have it. Like you said, the silos is not a big enough venue to have that many people. They could have it outside, it would be great, but.
Well, the plan is to have it outside, but still with 350 people, it's just, like you said, it's the awards assembly or, the awards part of it that is, everybody's just standing next to each other, elbow to elbow.
And they do a banquet, do they? Or not? I don't know.
Well, I think they just do a big barbecue outside.
Okay.
And they've
So,
got that new facility set up out there.
The building in the back, right?
Yeah, which is just a big shop, but it's designed to accommodate, it's got bathrooms and that kind of thing. So, but that's what it's for, is that kind of event.
so do we know when that was anticipated to be?
So it's June 26th is the date of
Just the date, right?
right now. So, and Sean there's also a junior walleye tournament, fishing tournament.
Yeah, there's a kids
They
one
contacted
too.
me, so, it's all, I was kind of waiting to see if we were gonna get another guidance document about phase 2, kind of like what we did for phase 1 before I got too far into it, but they're gonna need answers soon, so I'll have to get going on that. Or we will, if he says something, but who knows.
Okay. One other thing I had on my list, if we're kind of done with that, is, was the farmer's market approved? Did we approve that through the Board of Health?
I brought the documents today to do that. But
Oh, you
we don't
did?
have a
Okay.
quorum, so we'll have to do it. Their first one is next Thursday, and so next week's meeting, I assume we'll have another meeting next week. We'll have to make sure we have a quorum from now.
Mhm.
Yeah.
It doesn't, I looked at the law last year, and it doesn't specifically say you have to do it annually. And since the farmer's market hasn't changed locations or any of those things, the approval, I believe, is there in perpetuity. I mean, Corey could answer that if we don't get a quorum next week, we could see what his thoughts are on it and we'll be able to, but, yeah.
So I guess, what's your thoughts then as far as for how the plan for that? How that look?
Well, I visited with Heather because she is more into that with her coupon thing for the seniors, and it sounds like they have a plan. And if you know Chris Hedinger, she's very attention to detail, and so I'm sure, I haven't seen the plan, but I'm sure that they're going to have hand wash stations, sanitizing stations. I know that she's already got distancing done and stuff like that, between the vendors and stuff. But I haven't actually
We talked
seen.
at length last week, or right before Heather, there was an email about, we have to figure out what porta potties, if they can have them or not. But that, beyond that though, Chris has been in touch with me, and DPHHS has given out a farmer's market guide.
Yeah, they did.
So,
And
so
I did
we're not
send that
having
to her.
to invent that. So.
Yeah, I sent that to her right when it came out, so she does have that.
Yeah, the
Okay.
Department of Ag came out with one as well, so there's plenty of resources for them, and Chris seems to be on top of it. So.
Yeah, she's pretty good about that stuff. So I guess we had a wedding, that was about a couple weekends ago that had 150 people at it that I didn't know anything about. It was out at Trails Head, and so I'm thinking about, I thought that I had all the ministers on board, but apparently this gentleman did not get the memo. So I was thinking about visiting with them somehow, either by phone or by letter or something, that if they know that they're gonna have an event that's, over 50 people, that, because we don't know who's all getting married, but, whoever is doing the wedding, would know. So I thought it would start there, with the ministers, and just, kind of give them a heads up that they do need to, ask the families to call us if they're, having a big event like that. So just a matter of communication, but I had talked to several of them, when everything shut down, and so I thought we were all on the same page, but I think that needs to be revisited, so I will do that this week, early next week.
Yeah, if you need help with that too, let me know, Teresa, because obviously with the mansion having to go through and trying to go through all the hoops with us, come up with a plan, it's totally inappropriate for a church to just go off and do a thing without
Yeah.
having a plan. And like I say, starting June 1st, if they have a plan and it's reasonable, we can allow it if they have a plan.
Yeah. Yeah, I just don't, Sean and I are just, over the top as far as stuff that we have to, do. And I just don't think these events that are under 50 people, I mean, we can give them the guidance and stuff, but, we just can't take as much time as we did with our first event. We just can't keep doing that with every event unless it's a larger one. So people are gonna have to take responsibility.
But we have a good start for them.
Well, so yeah, you develop a good template for them to follow.
Yeah, I agree. That's kind of why I did that template, so.
Yeah.
Yep, I think, that's all I had, except I got an email from Corey. I don't know if we're gonna talk about that. If you guys got the same email about, opening up or doing something different with the first floor when the trials start. Did you guys get that email?
He wanted to pull the chains off.
Yeah.
I see your name was on
Yeah,
there.
I got
I think it was just you and me though. I don't
Well,
know.
Mike knew about it. Was that via email?
I just heard that they put it out. So since I got anything, so.
Cause I kind of thought you would be here, but, so.
Yeah, and I was planning on bringing it up as well. I mean, if it's part of his plan, and it sounds like the courts are very actively telling him how to proceed on things. I mean, moving those chains is not a significant issue for the rest of the courthouse and the plan. I don't think so.
So I had a meeting, we had a teleconference with, Judge Minahan and, Lewis and Clark Public Health and myself and Corey and Val, a couple of weeks ago, anticipating opening up, so they could have jury trials. And, it says in the guidance that, they're supposed to work with the public health department, on setting up, how they're gonna do the jury thing and stuff like that. So we kind of have that in the works, but, I think his concern was, getting them from the first floor to the second floor. So.
I guess one of the requirements was for hand sanitizer to be there. in the courtrooms. And
Mhm.
so has that had, and I know we have it throughout the building, but have we done anything in the courtroom?
Yeah, I don't know. I just know that our, you know, the jury box obviously is not gonna work, so I think he was, working on a plan for that. You know, the room is just too small, the social distance, you know, and how they're gonna do the jury selection and, you know, stuff like that, stuff we have to work on. And he may already have a plan, but the email I got sounded like he was more concerned about, you know, the way we have the first floor set up is not gonna work on those days, you know, so. So I guess we just need to,
And I think it's maybe for everything, because he's worried that the victim's advocate, people are afraid to come in and see the
Oh.
change. So I think he'd like to
Uh-huh.
see that chain going upstairs, just taken, you know, removed for now.
just,
Well, yeah, removed, period. And once again, I just they have a plan. You know, hand sanitizer, and we're moving forward that way, I think.
have you talked to him about this?
No,
And it just-
because that email just came out, was it on Friday or today? I just saw it today, so.
Yeah, I just saw it today.
so,
Mhm.
Yeah.
So we'll get together with him, I guess, and work on that. And then the only other thing I had, was, since we're going into phase 2, do we wanna continue to do, temperatures on employees?
That's on my list as well.
Pardon?
That was on my list to discuss as well, so
Okay.
I don't know how. I guess, what does it say? It says, what does it say?
Under the employees, is that what you're thinking? Yeah, because guidance applicable to all phases is still
Yeah.
temperature checks
There you
and
go.
symptom screening.
That's what I was thinking, yeah.
Stage 3.
Right.
Yeah, I think I had that all highlighted too, and then I think I forgot to grab it.
Yeah, it says employer should.
Is that causing any issues from your standpoint, Teresa, and your department's ability to get things done? Having
Oh, wait,
planned-
yeah, no, we can keep doing it. I just, you know, wanted to bring it up. Everybody's been good about it except for a couple of elected officials and their staff. So otherwise, you know, we're not hearing a lot of complaints, but then we might not hear them either, since we're the ones doing them. But, you know, everybody seems to be fine with it. I don't know, Nicole, do you hear any feedback?
It takes, you know, all of 1 minute
Yeah,
to, even if you're going to the public health office, to go in and
yeah.
get it
So-
done.
We have the equipment, I can still get the probes and everything, so that's not a problem. And we have the staff to do it, so, if we wanna continue, that's fine, but I just wanted to bring it up and. But I know we can't make any decisions anyway, so. But a new mask and I don't like it. Doesn't fit me very good. Okay, that's about all I have.
So I think the only other probably item that we should discuss is, and I'm sure Cassie's here to talk about masks, is and we can't make any changes today. But when we go to phase 2, should we consider allowing the servers to not wear masks. And I did forward you an email from DPHHS and what they feel is appropriate for masks. And then, so that's a conversation we have to be ready to have. You were on that email, right? But I sent it probably on Friday, Thursday or Friday, on Deb Atkinson from the Philippines.
Mhm.
So. And just, to explain what he indicated was that the reason the state, it's goofy, he'll say, it's typical state talk, right? We would recommend them if we were giving rule or giving recommendations, but we're not giving recommendations. And then he also goes on then to say that potentially the reason that the governor's Joint Information Center, whatever, the group that's putting all these guidance documents together, did not require the masks is to allow the local governments to have their own regulations and to not step on toes. That's one thing. But the other is that servers potentially are not having the lengthy contact time that they're worried about, that 15-minute to 30-minute contact time with the clientele. And so potentially that's a reason that they could go away from wearing masks. That was what his comment said. So, and I forwarded that to you.
Doc, you want to weigh in on that? Are you comfortable with that? I mean,
I think,
we're letting our guard
I think
down.
the masks are a good idea, to tell you the truth.
Okay.
They're really good.
Can I give you my opinion? Should be wearing them all the time. Cassie Cooper, by the way. My number one concern, because I work 10 to 12-hour shifts, is I understand, and we're happy to follow whatever guidelines you guys set forth. You require the servers to wear them, but in my line of work, I am the cook, the server, the bartender, the dishwasher. And I wouldn't say the panic attacks, but the breathing that it requires to wear a mask.
It's hard because you're breathing in that dead space.
You're breathing in that, the oil in the kitchen, it's 100 degrees in that kitchen. So you're wearing these masks, so that the risk for that for my staff is something I didn't think about until we had to wear them all the time. So that is a concern of mine with my employees. We don't touch the food physically. We don't do any of that. So to see some of these other places that don't have to wear a mask and they are physically touching our food, doesn't make sense to me with a mask and what you guys are saying. There's a lot of examples of it that you can see around town too. So if you can fill me in a little bit better on the reasoning that I get behind it, being a server, is that you're handing people food. Am I wrong on that?
Well,
I would say that you're not absolutely wrong on that, but you're also breathing on it too.
Okay, so when I go into a grocery store and I'm breathing on all that,
Look, all they asked me about was, do I think it's a good idea?
Right.
Yes, I do.
Yeah.
What the grocery store's doing, I don't know.
Yeah.
What people are doing in the restaurant, that's my opinion. Whether it holds water or not, I'm not 100% sure. You can argue it both ways, but I don't think I'm gonna change my mind on that.
well, I'm not gonna argue with you. You're not the one making a decision, but these two over here have a pretty big impact on it, and I
Which
do
two?
not want
Which
to
two?
be.
Wait a minute, which two? Which two? These two? Or these two? Which two are you talking about? I'm serious. Which two are you talking about?
Sean
You're
and
talking
Teresa. Yeah,
Oh, okay.
so Doc is the health officer.
right.
So he ultimately does have the decision making for this process, so.
For us in this, what we've heard in the meetings is basically from you two. So that's why I was pointing at you guys. Is that who I am listening to? being the manager of the bar. So,
So let me just ask you some questions.
Yeah.
So, cause I've been in your facility, so you're, are you having people sitting at your bar?
Nope.
No, okay. So that's not an issue, and I don't remember that we required a mask in the kitchen.
you don't
Did you
require
do
it, but
that?
you do if we serve the food, which means I'm cooking and serving. So I have to wear it
So you-
while I'm cooking.
Okay. Well, you wouldn't have to though.
If you've ever been in our restaurant,
I have.
you would know I have to.
Well, I think what Cassie's saying is it's just, and let me know if I'm wrong.
Yeah.
But the idea is that she's cooking, serving, she's running around, and to be taking her mask on and off
Oh,
is
right.
actually
Mhm.
not what we want anyway.
Right.
And
No,
that's-
right.
no.
And I forwarded her email, Cassie sent one last week, prior to probably this meeting last week, trying to explain that concern that she's afraid that her employees are actually touching their faces more now because
Yeah, yeah.
they're in the kitchen and panicking a little in there and then go to serve.
Mhm.
Um,
And there just isn't any way to change that. My only concern is, the rule is if you can't social distance, you have to have a mask. So the only time in my mind you really need to have a mask is when you take the food out and serve it to the people, because this is 6 foot. I can't get Daryl his food, from here. And so, we went into a restaurant in Red Lodge this weekend, and the lady stood quite a ways away from us, didn't have a mask on, and then came and, this is like serving 101, but, reached over all of us, number one, and served the food backwards. 'Cause I've been a food server before. And I literally almost went into a panic, but, really it's about just that exposure there. To me, that's really the only concern I have, is just that exposure, because you can't social distance that. So.
And I completely understand it. I do, I get it. We're following it, we're doing it, we're happy to do it. But if the issue is the food, when I go to a grocery store, or let's say Town Pump, I'm handing them my food, and they're touching it, they're touching money from the previous person, then they're handing my food back to me. This is what does not make sense to me. So,
yeah, I don't,
You know what I'm
personally, I don't
saying?
think it's the food, it's the contact with.
they're breathing all over it, touching my bag of chips.
No, I'm talking about you as the, employee or the server going to serve the public. It's not the food that, of course I'm worried, let's hope you're not,
Yeah.
that nothing's happening there, but also it's that contact
Mhm.
going back and forth between the client and the server. We have, the grocery store issue, we have been hammering them about why they get to have all these other areas where there's no regulations, and they just said that that's how it was from the beginning, and they just have to follow that rule, and I'm sorry, we can only manage things we can. The other hard part is that the regulations specifically say that the food must be served to the customers at a table, so you couldn't even set up at the end of the bar, hey, table 5, you can come grab your food now. Not that you would necessarily want to do that in your restaurant, but there are not options. The food has to be served. That's specifically in the guidance.
Yeah.
Well, I think, we can't make any decisions on it today, but there is more information coming out about masks. I know the CDC came out with something over the weekend. I think it's just saying, it's just a great idea to have them. Now, specifically to what we're talking about, I don't know, Cassie, is there something that we're missing that we can do to do what we're trying to do and you not, and your staff not have to go through it, you know?
Yeah.
I don't think the board is necessarily stuck on masks, just like we told one of the bars that they can put up a plexiglass along the bar so that the bartenders don't have to have masks on while they're mixing drinks. But
So is that a thing? The bartenders have to have masks on while they're fixing drinks?
if they were serving, because there are, in certain bar locations, the tables are still, even though they're not at the bar, they're still
Right.
closer than 6 feet to the bar.
But if they're making a drink, they don't have to necessarily. If they're making it, they set it right there for the server to take.
If they're
Correct.
6 feet, they can maintain 6 feet,
Okay.
but if, in this situation, they couldn't
Right.
maintain 6 feet because of the walk, it's a long bar where people have to walk by.
Yeah.
So it's not that the people are at the bar, but they couldn't maintain 6 feet, so they put in a.
Yeah.
You know,
Yeah, I think the main concern is for me personally, and I haven't been into a lot of places because I work a lot. But and there's a few of us that have to cook, wait, serve, and it is something to be able to breathe in those things. And then to not touch, like we've touched your mask a million times.
I have,
You know what
yeah.
I'm saying?
Mhm,
So to be able to not do that,
mhm.
I mean, we do the health screening every day, everybody signs up on the thing if they're sick. I mean, I have a girl quarantined, she had an earache or something like that, but she's just not, I just don't do it because I'm following your guys' guidelines. And she was negative in case anybody. But that concern is great, our kitchen is 100+ degrees, and to wear a mask is a health issue, I think. So it's just something to think about. Not necessarily my servers, of course, we don't like it that much. We're running and it's hot in there and it's hard to breathe. But the cooking, serving, all of it is tough.
Yeah, and that's, with smaller establishments, that's what happens, in the larger establishments, you have a cook and
Right.
everybody has their own thing that they do, so the only person that would have to wear a mask is the one that's actually serving the food, where you guys are making it and serving it, and so, like you said, I totally get that.
Something to think about. I don't ever want it to become an issue because someone can't breathe. And I know my oxygen levels go way down when I'm doing all of that. And I've tried multiple different masks to try to make it seem better, but it's just hard to do.
so we'll be having, I assume, a meeting on Monday next week. If we can somehow get it.
I want to get another member to have a quorum, yeah, otherwise I don't know if there's a whole lot of sense in having a meeting if we can't have a quorum.
No.
Right, but if we can get that put together, we'll, and we will, I am looking into more mask stuff, just to make sure that what we're doing is right. Or, maybe there's some other solutions out there.
Yeah.
So did you contact the people running the farmer's market to get a plan from them, or?
Yeah, well, Chris, there's guidance for farmers markets, as long as she follows that guidance. I don't think we need to have an actual plan from her. But, my intention is to, and I did this last year anyway, was to go to the first farmer's market and just, there's kind of some process stuff that has to go on anyway.
Yeah, the guidance actually came out from DPHHS, so, it's a guidance, I think, that they're using for all the farmers markets. Well, I don't know if everybody's using them, but that's the reason they put it out, so.
Would you like to see something more specific, Mike? Is that what you're asking? or-
No, I just wanted to make sure that they had some kind of a plan that they were to get to you the falls, we don't end up in a situation. So then, do we tell Mike to pull the chains from the stairwells upstairs, then, or what are we gonna do?
Yeah, I mean, I don't have a problem with that. We made it, put it up to the different, department heads on whether they're going to have appointments or not appointments.
Oh, okay.
It's really no different than the clerk or the EMD having people come in and going into their, and paying taxes and or paying registrations and so. I mean, to me, there's no difference. Want to make sure that we have some hand sanitizer handy, and there's hand sanitizer right at the base of the stairs. I don't know what's upstairs. I guess Corey's here to wanted to ask him if there's anything specific about that. You were talking, just take them down for, not just on jury days, but just let's get rid of them now, right?
Everyone in the upstairs is fine with that. I mean, I think we had talked about Tuesdays and Fridays as days when we have a lot of court, but the reality is if we're going to phase 2, I don't know that they really serve a purpose, and I myself have almost fallen a couple times on the stairs trying to get around them. So we're all in favor of removing those barriers at the stairways, unless there's a compelling reason to keep them.
Okay, is there any guidance so far as like the swimming pool, is that gonna open, or do we know, or?
There is some guidance coming out on swimming pools.
Yeah, no, there's guidance in here.
Yeah, there is.
Yeah.
I just didn't bring my copy.
Well, I believe I heard that they're gonna open, or they're gonna wait till phase 3, but that one thing they might try to do during phase 2 is train lifeguards, because all the lifeguard trainings have been canceled. So even if they couldn't open today, they wouldn't have anybody ready. But that's all I've heard, and that's not from the source.
Yeah, so it's pools that license public accommodations, looks like that's been addressed.
I know there's some
So
controversy,
that
but
would help.
they know that chloride and bromide, kill the virus. So as far as the water goes, that's not an issue. It's everything that goes along with that, is what, the issue is, like the dressing rooms and that kind of stuff.
When does the pool normally open?
I don't even know. I don't have little kids, so.
Like the week after school, it's
Yeah.
beginning of June.
So since we don't have a quorum, we can't really make any kind of decision for Kathy, as far as.
Right, regarding the masks.
Yeah. So,
That was the board.
if you wanted to stick around and hear all the rest of this, but, we honestly understand completely what you're saying, because I hate them too. I mean, I do, but,
And for me, it's not about hating them as much as it is the
breathing
health
in your
concerns of
CO2.
my
Yeah.
staff that works 10+ hour days having to wear them like that. So That's all I want you guys to consider is that kind of thing.
Okay, thanks
We
for
are-
coming.
We are hearing it from other, I mean, I hear it from lots of different restaurants. Cassie has just been a little more active with it. And just as they were very active in putting a plan together and following the guidance, they're, you know, she's voicing her concerns. So thank you. Cassie.
Thank you.
You got anything else, Sean, or
I don't.
anybody else have anything to discuss, or?
I can't think of anything.
I was like, you know, I was just wondering, did you guys just vote to follow the governor's phase 2? Is that the plan?
We don't have a quorum, so.
Oh, they're not. Well,
So we were just discussing stuff, so we kind of be ready when we did have a quorum to make some decisions.
so absent any action from you, the governor's phase 2 is what will be the controlling, right? That, you guys all agree with that?
Yeah. So when you say that, does that mean that the mask issue would, we've done that? We didn't necessarily tie it to phase 2. We said we would look at it again at phase 2. Make sure we talked about it, but I don't know if that means that phase 2 comes in by the governor's directive, if that then makes the other one sunset. Do you have any thoughts on that?
Well, what specifically are you referring to?
Well, we're the only county supposedly in the state that requires masks to be worn by servers when they're serving food.
Okay.
And we passed that when phase 1 came in from the community direction.
So was the requirement tied to phase 1 or was it in general? I mean,
I
did it
think it
say
was-
this is, that's what will determine the
I
answer.
mean, I think we said that we would look at it again at phase 2, but I don't know what that means.
So the regulation says less, local restrictions that are, local, guidance that's more restrictive is not prohibited. So if you want to keep, and if the board wants to keep the mask requirement, it may do so. If you, and I guess the wording of your previous decision is what will matter, or whether the masks continue or whether they expire with phase 1 and switch to phase 2.
So I think we'll definitely want to clarify one way or another on Monday. Because then we have a quorum.
So what I'm kind of hearing from other counties is, actually, time. And so exposure time. So, that's what a lot of counties are actually going by instead of wearing masks, is that they just very quickly, get the food out and then back away. And our server did that. She stayed quite a ways back and just, gave us our food real quick and then, stood back. And we know that, we know exposure time is a big issue, with the virus. So the, least amount of time you're exposed, the least amount of chance you're gonna get exposed to it. So, so it's either, one of those two things, just, quick exposure time versus mask, basically. I mean, wouldn't you say?
Yeah. That's what we would have to, I mean, that's what it's gonna come down to. I think that's the only way you can look at it and see why. But we need to
So an
maybe do a
option,
little more looking into that.
so I guess an option that we could have, is health screening, which I don't think they're doing.
For the clients, I mean, the
Mhm.
clientele.
A health screening for their, employees, and then, just go through some training with, time wise, getting that food on the table and then backing off so that you're not just standing there, because that happens, especially a place like the Bull, they know their customers, and so they're, you stand there at the edge of the table and shoot the breeze, and, and that's what you can't do, so to me, in my mind, that's our options, is to either, do away with the mask for the servers, and do like a health screening and some training. To me, that's really our only two options. As I can't think of anything else.
The employees already are required to do health screenings.
They are doing them over there.
And yeah,
Oh, okay, I didn't know that.
that was part of the reopening plans that they've all signed.
Oh, okay.
So
I didn't remember that.
that part is good. So,
Okay. So it's just something we have to think about, and then I guess make a decision for them. Are you getting any other complaints about any other places serving in town, or?
you mean for masks?
Yeah.
Yeah, I've gotten 2 or 3. Yeah.
Oh, okay.
A lot of them, when phase 2 came out, they just said, hey, are we gonna be able to remove the masks at phase 2, because we're really struggling with them.
And everybody brings up the whole grocery store thing, and I want to say, that's personal responsibility, but how can we solve them touching the money, and because they're actually doing the same thing, they're touching the money as well.
Well, the difference at a grocery store, and I should have brought this up, is that you're expected to take responsibility of your food. When you're at a restaurant, you're eating that food right there. When I go to the grocery store, I buy my vegetables, I buy all of my food. I go home, I wash my vegetables.
Right.
Right? I mean, that's
Personal
implied.
responsibility.
You have to take on some responsibility. So.
But that's what I hear over and over and over. Well, what about the grocery store? What about the grocery store? And
they have implemented more than they had
yes,
previously.
they
So.
have. Well, we were getting so many complaints. We had to. I talked to Eddie 3 times and finally sent Sean down there, and he talked to Mike, and it got done. So. I guess he just took Sean a little more serious than me.
Well, I talked to
guess.
Mike. I have always worked with Mike, so I don't know.
Yeah.
So, and he just was good with that stuff.
So they do have, and I think that makes people feel a lot better that they, are seeing that, because they just weren't seeing any changes. They weren't seeing anything stuck on the floor, even though I had social distancing, little signs up, got the hand sanitizer station in there and stuff, which is about the most I could do on my own. But I had talked to them about putting tape on the floor and, different things, at least 3 times, and getting the plexiglass up and stuff, and it just didn't happen, and we just got complaint after complaint. So at least now when people walk in, they see that there's an effort being made. And I didn't get any complaints last week, so maybe that's a good thing.
You got something, Nicole?
I do. This is from Cassie Cooper. She said, we do a health screening, which I said while I was still there. And then she has another follow-up comment that says, like I said while I was still there, we wash and sanitize our hands after every money transaction. I don't know that everybody else is doing that, and I can't answer for them, but we are.
Yeah. I mean, that's part of, they have to do that whether it's COVID-19 or not.
Yeah.
That's standard restaurant protocol stuff.
Anybody else have anything? If not, I guess we will adjourn and we'll set our next meeting for Monday and see if we can get a quorum. If we can't get a quorum and get another member, there's no sense having a meeting.
Is 1 o'clock, you want to do 1? You want,
Yeah, I think so.
Are you having a commissioners meeting Monday?
Yeah.
Cause sometimes that'll run into it if it's on Monday, I just,
But we'll see where we're at, but right now we'll start for 1.
Okay.
if you had one this morning, right? And that worked out, so.
So, was anybody able to get a hold of Wendy or?
Okay, so I went and talked with Jenny this morning. I guess Wendy does no longer work at the, and they don't know where she's at.
Oh,
So,
so that's not even an option.
so I talked with Jenny and, she would like to put someone in the hospital to be set up
Okay.
when that time comes.
Mhm.
And what she explained to me is they're getting ready to fill that position. Wendy's old position. Yeah, so she'll make a determination of whether it'll be that person or someone else. So I think we'll have someone.
Did you have any luck?
No, I did not have any luck.
Doc and I were talking about trying to fill the position and we're trying to come up with people we thought would be good for the Board of Health and he went and talked to someone, but apparently it didn't work out. So
Okay.
we'll keep trying.
Yeah,
All right,
I
yeah,
reached out to someone too.
I have to get a different mask. This is the first time I wore this mask and they're brand new and I didn't realize it didn't fit me. So that's why I'm touching it like.
Thank you, Nicole.
Thank you.
For your computer prowess.